Don't know a lot about schizophrenia. Got that one right. Ding, 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 ding. One right. Let me know how you did below if you want to. All right, guys, it is my second video in Study With Me for mental health. What we're doing is NCLEX HESI style questions over mental health, and I'm using Lippincot's Q&A review for NCLEX RN. This one, I'm gonna do 10 questions, and they're over schizophrenia. I'm gonna see how many I get right. You can play along with me. Are you ready, guys? Don't know a lot about schizophrenia. We will see how this goes. A newly admitted client describes her mission in life as one of saving her son by eliminating the provocative sluts of the world. There are several attractive young women on the unit. What would the nurse do first? Number 1, ask the client for her definition of provocative sluts. Ask the young female clients on the unit to dress less provocatively. I'm going to say that's politically incorrect. Ask the client to discuss her concerns in the next group session. I'm thinking probably not. Ask the client to inform the staff if she has negative thoughts about other clients. It's 1 or 4. I'm thinking 4, but if they don't trust you, it's not going to be very successful. Let's see if I'm right. I'm going with ask the client to inform the staff. That way they can protect that staff. 4, it is critical for the nurse to ensure the safety of others by knowing who the client might think needs elimination. Asking the client to explain what she means or discuss her concerns at the group session are possible interventions for later in the client's hospital stay. Wearing appropriate clothing while hospitalized is generally a unit expectation for all clients. Got that one right. Ding, 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 ding. 1 right. Okay, a client diagnosed with paranoid schizophrenia is talking with the nurse. You know, when I thought everyone was out to get me, I was staying in my apartment all the time. Now I'd like to get out and do things again. What is the best initial response by the nurse? With whom do you want to do things? What activities did you enjoy in the past? What kind of transportation do you use? How much money can you spend? I'm going to go with what activities did you enjoy in the past? Asking who they want to spend time with, how much money they have, or if they have transportation. Those seem like things, we're jumping the gun there, I think. So I'm going to go with 2. What activities did you enjoy in the past? No, number 2, that's right. Ding, 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 2 right. Knowing the client's interest is the best place to begin to help the client re-socialize. Knowing with whom the client wishes to socialize, what transportation she has, or how much spending money she has may be relevant questions, but should be asked after the question concerning what activities the client enjoyed in the past. 2 right. All right, question 3. A client is becoming agitated during a discussion group. She states, "I know that all of you hate me." She leaves the group and goes to her room. Which action by the nurse is most therapeutic for the client? After group, ask the client to talk to the nurse about her concerns. Ask the client to return to group and share her feelings. Explain to group members about the client's problems. Probably not the right one. Ask the group members to apologize to the client individually. Probably not the right one. Okay, so 1 or 2. Are we going to ask the client to talk to the nurse about her concerns after group, or ask the client to return to group and share her feelings? She was becoming agitated. She already chose to leave. She already did share her feelings, sort of. I'm going to go with 1. After group, ask the client to talk to the nurse about her concerns. I'm going to say, let's not go back to group just yet. So 1, yay! 3 out of 3, guys. It is appropriate to talk alone with this client about her feelings. A suspicious client is unlikely to agree to talk about feelings in a group. It is a violation of the client's privacy to reveal client's problems to group members. The other clients in the group have no reason to apologize, and the nurse should not ask them to do so. Number 4, a client who was diagnosed with undifferentiated schizophrenia 8 years ago is admitted to a unit because of increasingly severe mood swings. His diagnosis is changed to schizoaffective disorder. He asks the nurse, "So now what? My risperidone," which is risperidol, "is just not doing the job. How should the nurse respond?" 1. Your doctor will probably increase the dosage of your risperidol. I don't think so. I haven't read the other answers, but I'm going to say no, probably not. The nurse wouldn't say that. With your mood swings, you may need to take a mood stabilizer along with your risperidol. Good grief, she's given a lot of medication stuff. Number 3, the doctor will have to see how severe your mood swings are before he decides what to do. 4, if you are not suicidal, no change will be made in your medicines. Well, I know it's not number 4. The diagnosis went from undifferentiated schizophrenia to schizophrenia affective disorder due to increasingly severe mood swings. Looking at all that information in the thing, I'm going to say, with your mood swings, you may need to take a mood stabilizer along with your risperidol. I'm going to guess that one. I didn't picture nurses making guesses about what medications the doctor may or may not prescribe, but the other answer would be 3. The doctor will have to see how severe your mood swings are before he decides what to do. I'm going to guess 2, but I don't know. 2 or 3, but 2 is my guess. Question 4. 2. Woohoo! Okay, schizoaffective disorder is commonly treated with a combination of antipsychotic and mood stabilizing medications. Risperidol alone will not manage the mood symptoms even in large doses. The severity of the mood symptoms is not a factor in selecting treatments. The mood swings are upsetting to the client and need to be treated whether or not there are suicidal thoughts. Okay, guys. 4 out of 4. Ding, 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 ding. We're doing great. All right, 5. A client who is neatly dressed and clutching a leather briefcase tightly in his arms scans the adult inpatient unit on his arrival at the hospital and backs away from the window. The client requests that the nurse move away from the window. The nurse recognizes that doing as the client requested is contraindicated for which of the following reasons? I'll be honest, probably would have just moved away from the window. He's neatly dressed. He's clutching a leather briefcase. He just arrived. He backs away from the window. 1, the action will make the client feel that the nurse is humoring him. I doubt it. The action indicates nonverbal agreement with the client's false ideas. That sounds right. 3, the client will think that he will have his way when he wishes. 4, the nurse will be demonstrating a lack of composure over the situation. It's not a lack of composure. I'm going to go with he doesn't have a reason to be backing away from the window. And just because he has, a false idea doesn't mean he needs to impose it on other people. So I'm definitely going to go with 2. The action indicates nonverbal agreements with the client's false idea. That's smart. That's smart. I knew the answers. I read them, but I would have backed away from the window. Okay, let's see if I'm right. 2. The nurse's nonverbal behavior, moving away from the window as the client requests, indicates agreement with the client's false ideas. The client's behavior is likely to be reinforced if the nurse takes steps to agree with the false ideas he holds. Ding, 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 ding. Guys, mental health is my strong point, I think. Number 6, a client reports having thoughts of being followed by foreign agents who are after his secret papers. Which response by the nurse is most appropriate when responding to the client's disturbed thought process? I don't see any foreign agents. I think these thoughts are frightening to you. I don't know what you mean. I'd like you to come to group with me right now. I think it would either be, I don't see any foreign agents, or I think these thoughts are frightening to you. Client reports having thoughts of being followed by foreign agents who are after his secret papers. He has a disturbed thought process. Which response is most appropriate? He doesn't say anything about being frightened. I mean, I would be frightened. But he could be angry. They're after him instead of frightened. I'm going to go with, I don't see any foreign agents. I'm going to go with trying to ground him in reality, but I think it could be wrong. Let's see. Number 6. The client's disturbed, 2. I'm wrong. Womp, womp, womp. Guys, I should have said, I think these thoughts are frightening to you. Here's why. The client's disturbed thought process likely reflect this client's paranoid delusions. The nurse should acknowledge that the thoughts are frightening the client. Telling the client the nurse does not see any foreign agents is an appropriate nursing response if the client is having disturbed visual sensory perception and is having a visual hallucination. So if he said, I see foreign agents over there, then she would say, I don't see them. That makes sense, because just because you don't see them doesn't mean they're not following him. Okay. Telling the client the nurse does not understand what the client means is an appropriate response if the client has impaired verbal communication. Suggesting that a client participate in group activities would be appropriate if the client had a nursing diagnosis of social isolation and was staying in his room. So yeah, I should have said these thoughts sound frightening. Got that one wrong. 5 out of 6 though. We're doing pretty good. 7. Ooh, this one is putting things in order. I'm not good at these. Police bring a client to the emergency department after she threatens to kill her ex-husband. She states emphatically, the police should bring him in, not me. He's paranoid about my dating and has been stalking me for weeks. He's probably off his medicines. His case manager and the police won't do anything. In which order should the following nursing actions be done from first to last? Okay, she's threatened to kill her ex-husband. She says he should be brought into the ER, not me. He's paranoid about my dating. He's been stalking me. He's probably off his medicine. His case manager and police won't do anything. Okay. She was brought in because she was threatening to kill her ex-husband. What action should be done from first to last? Ask about the marital problems leading to the divorce. Assess the client's risk for harm to self and others. Obtain the name of her ex-husband's case manager. Interview the client about her current needs and situation. I have no idea. I would say one of the easiest things to get from her is the name of her ex-husband's case manager. Like, right away, let's get a person involved. She wants you to know that because she said his case manager won't do anything. So let's get the name of the case manager. Then let's ask about the marital problems leading to the divorce. Assess the client's risk for harm to self and others. And last, interview the client about current needs and situation. I don't think this is right, but I got 3, 1, 2, 4. Get the name of the husband's case manager. Ask about the marital problems. Assess risk for harm. Interview the client about current needs and situation. I don't think it's right. I really don't know though. It's not going to be right. Let's see. Number 7. Assess the client's risk for harm to self and others. We assess first. Interview the client about her current needs and situation. Obtain the name of her ex-husband's case manager. Ask about marital problems leading to the divorce. Let's read the why on this. The nurse should first assess the client's risk for harm, especially because the client could direct her anger to her ex-husband or the nurse. Then it is important to know more about the current situation and her immediate needs. Obtaining information from the ex-husband's case manager might help clarify the risk of harm to the client. Problems leading to the divorce are less important than the situation following the divorce. So, I thought, ask about the problems leading to the divorce. I thought maybe that's easier to talk about, but that could get them sidetracked. So that's the last thing. Assessing the risk for harm was the most important, so that's the first thing. Yeah, that's a hard one, guys. These put in order ones are hard. We got 5 out of 7. 8. A client who has been stabilized on medications for several months is at the clinic for a medication check. During a conversation with the nurse, the client suddenly jumps up, begins pacing, and wrings her hands. In what order should the nurse do the following interventions from first to last? Okay. Walk with the client to help decrease her anxiety. Okay, we're going to do all these. It's just what order. Discuss productive ways to solve her problems causing anxiety. Share observations about her anxiety-related behaviors. Ask the client about the sources of her anxiety. I'm going to say you walk with them first. Then ask about the sources of anxiety. Then share observations about her behavior. And then 2, discuss productive ways to solve her problems causing anxiety. So 1, 4, 3, 2. Don't feel confident. I don't like these put them in order ones. Okay, it is on the next page. 1, 3, 4, 2. I was close. I got a half right. I got 2 of them right. Okay, first, walk with the client to help decrease her anxiety. The nurse should first walk with the client to reduce her anxiety because the client must be at a mild level of anxiety before learning can occur. Sharing observations with the client. Next is share observations about her anxiety-related behaviors. Sharing observations with the client conveys a sense of caring. Later, the nurse can help the client connect the anxiety-related behaviors to her feelings of anxiety, which means ask the client about sources of her anxiety. Once the client can identify the source of anxiety, she can talk about solutions. Half right. So 5.5 out of 8. Ready for question 9? A client is receiving, I'm not sure how you say this, haloperidol decanoate, which is also known as Haldol decanoate. He begins to complain of stiff muscles, restlessness, and internal jumpiness. The client has all of the following medications ordered as needed. Which one would be most appropriate for the nurse to administer to decrease the client's symptoms? Okay, what will decrease stiff muscles, restlessness, and internal jumpiness? Is it lorazepam, otherwise known as Ativan, benztropine mesylate, otherwise known as cogenitin, trazodone, otherwise known as Destrel, or olanzapine, otherwise known as Zyprexa? These are all some strong meds. I mean, opine sounds like benzodiazepine. I don't know. Lorazepam I know will chill you out. It's for anxiety. Trazodone will help you sleep. I would think trazodone and lorazepam both are going to help with stiff muscles. I'm going to go with Trazodone. Number 3. Let's see if we're right. The reported symptoms is 2, which is, I got it wrong. Let's see. 2 is, hold on a second. Benztropine mesylate. Cogentin. I've never heard of this. Let's see. Let's learn about it. The reported symptoms are signs of extrapyramidal side effects, also known as EPSE. The medication of choice is benzotropine, an anti-Parkinson medicine. Lorazepam is an anti-anxiety agent. Trazodone is an antidepressant used to enhance sleep. I did know what those 2 drugs did, at least. Olanzapine is an antipsychotic medication which could aggravate the extrapyramidal side effects. So he needs to take benztropine, which is an anti-Parkinson medicine, which will help with the side effects of his Haldol. All right, 5.5 out of 9 still, guys, I think is my score. One more, question number 10. Here we go. See if we can end on a positive. We started really great and we just been going downhill. Question 10. The parents of a 20-year-old female client diagnosed with paranoid schizophrenia admitted 4 days ago are attending a family psychoeducation group in the hospital. Which of the following statements by the mother indicates that she understands her daughter's illness and management? So we need to know which statement by the mother is correct or not false. I know that I'll have to do everything for my daughter when she comes home. That one's obviously not false or not true. The 20-year-old is not a quadriplegic. Yeah. 2, tasks as simple as getting out of bed and showering in the morning may be difficult for her. That sounds reasonable. May be difficult. 3, I know that visits from her friends at home should be discouraged for a while. That sounds reasonable, maybe. She won't experience a relapse as long as she takes her prescribed medication. And I don't like the won't. I'm going between 2 and 3. 20 years old, paranoid schizophrenia. I mean, depression would make getting out of bed and showering difficult. I'm not sure if paranoid schizophrenia would. Visits from her friends at home should be discouraged for a while. Why would visits from her friends make things worse? Maybe if she's paranoid, maybe she needs her meds to kick in before she sees friends again. It's 2 or 3. I think getting out of bed and showering, that sounds like depression, not paranoid schizophrenia. But I feel like visits from friends could be helpful. I'm thinking about A Beautiful Mind right now.
Ever just know something?
Constantly.
I'm trying to remember if in A Beautiful Mind, which you should see that maybe if you haven't, if he had trouble getting out of bed and showering.
I'm being held against my will!
I wonder, what if the medication she's on would make her tired? I'm going to go with 2. I'm going to go with that she may have difficulty showering and getting out of bed. 10... 2. Is that what I picked? Yes. Yay! So that's 6.5 out of 10. 65%. Clients with paranoid schizophrenia experience alteration in thought, resulting in introspection, confusion, and distraction from external reality. Simple tasks that require concentration and effort, including activities involving self-care, may be difficult for the client, especially during the acute phase of the illness. However, the mother should not need to do everything for her daughter. Yeah. Rather, the mother should encourage the daughter to do things for herself with guidance Visits from friends should be discussed with the client, and clients should be encouraged to visit with friends to minimize the risk of social isolation. I do remember in A Beautiful Mind some of his friends coming to see him when he was sick. That's a really good movie. Really like that movie.
I don't like people much.
Although relapse typically occurs with medication noncompliance, vulnerability to stress, a low threshold for stress, the number of stressors, and the client's lack of adaptive coping behaviors also can contribute to relapse. All right, guys. 6.5 out of 10. Let me know how you did below if you want to. If there's a certain subject of NCLEX questions you want to go over with me, let me know. I'm going to keep doing these. They help me. Hopefully you like them. If not, I'm going to title them really easy. So if they're not your kind of thing, you'll know to just skip that video. Or if you like these things better than some of my other videos, you'll be able to tell real quickly by the title, you know, oh, this is NCLEX practice. So thanks, guys. Thanks so much for learning about schizophrenia with me. Have a great afternoon.